So Teresa, we talked earlier about how many transplant patients are served through this clinic. Can you talk about how many patients you see altogether over the course of a year?
I'm not sure how many we actually see in the course of the year, but we do have about 700 registered patients in the Kidney Care Clinic currently.
700?
Yes, yeah, and that number has grown year over year.
And
Yes.
so what area does that include? I mean, obviously we're here in Nanaimo, but how far north do you go?
We cover, our area is Ladysmith North. So
Right.
we cover all the way to the North Island. So we have
Okay.
people who live in very remote First Nations communities, on some of the small islands in the north. Yes, so we
And they
serve
travel down to
yes, yes. Yeah, we
access
do
care.
offer some services via telehealth as well.
Now you mentioned telehealth. Tell us a little bit more about what that means.
So people have their appointment via telehealth, so they will go to a local hospital that has telehealth services, and then we connect with the patient via telehealth here. And so it's really just having a clinic visit over telehealth.
So over the phone.
Basically, or over a telephone or a television, because we can actually see the patient. This patient can see the healthcare provider here as well.
Oh, that's
Yes.
very good.
Yes, yes.
And would that be for the multidisciplinary team? Could all of that be done over
Yes.
telehealth?
Yes, yes.
And the nephrologist visit as well? Or would that have to be done in
yeah,
person?
the nephrologist visit can happen that way as well.
Oh,
Yeah.
well, that's
Yeah.
fantastic.
Yeah. The other thing is that we offer outreach clinics in Campbell River. So one of our nephrologists has a high number of patients in the North Island. And so he and the team travel up to Campbell River and Cumberland every 5 weeks.
So Teresa, I want to talk a little bit about your background. You are a nurse, so a renal nurse. Can you tell us how you came into this role?
I started my career actually doing renal nursing, and then I actually moved into a number of different areas, and about 10 years ago I came back into renal nursing and worked in the home dialysis clinic as the nurse lead there. And then 5 years ago I came up to Nanaimo as the manager.
In your management role, I guess you don't have direct patient, you don't do direct patient care anymore. Do you miss that?
I do.
You do?
I do.
Yes.
Yeah, so this is challenging in a different
Sure.
way, but yeah, that's one thing I do miss is the direct patient care.
Direct patient care.
Yeah.
So thank you so much, Teresa, for taking us on this tour today. It's been very interesting to get a bird's eye view into the world of care for both post-transplant kidney patients and those pre-transplant. So thank you very much.
You're welcome. It's been a pleasure. Thank you.